As a urologist and andrologist with extensive experience in sexual medicine, I have observed over the years how attraction between human beings is a fascinating phenomenon that goes far beyond words. In my office, I frequently see patients who report doubts about their ability to arouse interest in potential partners, and it's surprising how many are unaware of the biological and chemical processes involved in attraction. The initial attraction between two people is a complex process involving an intricate dance of hormones, neurotransmitters, and involuntary physical signals. As a specialist in sexual medicine, I can affirm that these elements are fundamental to understanding how and why we feel attracted to someone. When a person feels attraction to another, their body undergoes a series of subtle but significant physiological changes. Dopamine and norepinephrine levels increase, causing that sensation of euphoria and excitement. At the same time, cortisol, the stress hormone, also rises, causing that characteristic butterflies in the stomach feeling of moments of initial attraction. In my clinical experience, I observe that many patients don't understand why their bodies react in certain ways when they're close to someone who attracts them. For example, pupil dilation, increased heart rate, and sweating are automatic responses of the autonomic nervous system that we can't consciously control. During my international specialization in sexual medicine, I had the opportunity to extensively study how different cultures interpret these signs of attraction. It's fascinating to note how, regardless of cultural context, there are universal patterns in the nonverbal expression of romantic interest. Sex hormones, such as estrogen and testosterone, play crucial roles in this process. In women, for example, estrogen levels directly influence subtle attraction behaviors, such as voice modulation and specific body movements. Men, under the influence of testosterone, tend to exhibit more expansive postures and gestures that demonstrate confidence. As a medical professional, I consider it fundamental to demystify these biological processes. Many patients come to the office expressing insecurities about their ability to attract partners, without understanding that much of this process is governed by complex and often unconscious biological mechanisms. In my clinical practice, I frequently discuss with patients how overall health can significantly influence our ability to emit and interpret signs of attraction. A hormonal imbalance, for example, can affect not only libido, but also our ability to express and recognize romantic interest. During my residency at a reference hospital, I participated in studies investigating the relationship between hormone levels and social behaviors. The results were enlightening. People with balanced hormone levels generally showed greater ease in establishing romantic connections and interpreting signs of interest from potential partners. It's important to emphasize that, although there are universal biological patterns, each individual is unique in their way of expressing and experiencing attraction. As a doctor, I always emphasize to my patients the importance of understanding and respecting these individual differences, avoiding excessive generalizations or unrealistic expectations. Modern medicine allows us to understand better and better the physiological mechanisms involved in human attraction. Through hormonal tests and detailed clinical evaluations, we can identify and treat any imbalances that may be affecting a person's ability to establish satisfactory romantic connections. In my experience as a specialist in sexual medicine, I have observed that bodily signs of attraction are true biological markers of romantic interest. During consultations, I often discuss with my patients how our body communicates interest in subtle and involuntary ways, and how this nonverbal communication is deeply rooted in our biology. One of the most interesting manifestations I observe in my clinical practice is pupil dilation during moments of attraction. This phenomenon, known as mydriasis, is controlled by the autonomic nervous system and occurs when we see someone who attracts us. During my international specialization, I participated in studies that demonstrated how this sign can be a reliable indicator of romantic interest. Facial gestures are also extremely revealing. In my lectures on sexual medicine, I always highlight how facial flushing, caused by peripheral vasodilation, is an involuntary response that frequently accompanies moments of attraction. This process is mediated by the sympathetic nervous system and is related to increased levels of adrenaline in the blood. As a doctor specializing in sexual health, I have noticed that many patients do not understand why their bodies react in specific ways when they are close to someone who attracts them. For example, the change in breathing pattern, with shorter and faster breaths, is a common physiological response that occurs due to the activation of the autonomic nervous system. During my residency, I had the opportunity to study how different medical conditions can affect our ability to express and interpret signs of attraction. Patients with certain hormonal imbalances, for example, may have difficulties manifesting or recognizing these nonverbal signals. A fascinating aspect that I observe in my clinical practice is how the tone of voice unconsciously changes when we are attracted to someone. Women tend to speak in a higher pitch, while men often lower their voice tone. These vocal alterations are mediated by subtle hormonal changes and have deep evolutionary roots. Body movements are also extremely revealing. In my consultations, I explain to patients how body posture naturally changes in the presence of someone who attracts us. There is an unconscious tendency to physically orient ourselves towards the person of interest, a behavior known as positive body orientation. As a specialist in sexual medicine, I frequently discuss with my patients the role of pheromones in attraction. Although they are less evident in humans compared to other mammals, they still exert a subtle influence on our social and romantic behavior. During my specialization, I participated in research investigating how different hormonal states affect the production and perception of these chemical signals. In my clinical experience, I have observed that casual touch is one of the most significant indicators of attraction. When a person feels attracted to another, there is a natural tendency to seek subtle physical contact, even if apparently accidental. This behavior is related to the release of oxytocin, known as the love hormone. As a medical professional, I always emphasize the importance of understanding these signals within a broader context. A single isolated sign may not be conclusive, but the consistent presence of multiple indicators usually suggests genuine romantic interest. During my international lectures on sexual medicine, I frequently address how different cultures interpret these bodily signals. It's fascinating to note that, although there are cultural variations in the expression of attraction, the underlying physiological mechanisms are universal. As a doctor specializing in sexual medicine, I have dedicated much of my career to understanding how our nervous system orchestrates the complex symphony of romantic attraction. In my office, I often explain to patients how our brain processes and responds to attraction-related stimuli in a fascinating and highly sophisticated manner. The limbic system, the brain region known as our emotional brain, plays a crucial role in this process. During my international specialization, I participated in studies that used functional magnetic resonance imaging to observe how different brain areas activate when a person is in front of someone they feel attracted to. A particularly interesting discovery that I share with my patients is how the amygdala, a brain structure related to emotional processing, shows increased activity during interactions with people who attract us. This activation is directly related to our ability to detect and respond to subtle signs of romantic interest. In my clinical practice, I observe how the hypothalamus, an important regulatory center of the nervous system, coordinates the release of different neurotransmitters during moments of attraction. Dopamine, for example, is released in significant quantities, creating that feeling of pleasure and reward that we experience in the presence of someone special. During my residency at a reference hospital, I had the opportunity to study how neurological conditions can affect a person's ability to express and interpret signs of attraction. This knowledge has been valuable in helping patients who face specific challenges in this area. A fascinating aspect that I always discuss in my lectures is how the autonomic nervous system influences our involuntary physical responses during moments of attraction. The dilation of blood vessels, increased heart rate, and changes in breathing are all controlled by this system. As a specialist in sexual medicine, I often explain to my patients how the prefrontal cortex, the brain area responsible for rational thinking, interacts with the limbic system during romantic interactions. This balance between emotion and reason is fundamental for the development of healthy relationships. In my clinical experience, I have observed how the parasympathetic nervous system, responsible for the state of relaxation, needs to be in balance with the sympathetic system, responsible for arousal. so that we can experience and express attraction adequately. During my international research, I participated in studies investigating how the cerebellum, traditionally associated with motor coordination, is also involved in processing romantic emotions. This discovery helps explain why some people may feel clumsy in the presence of someone who attracts them. As a doctor, I always emphasize to my patients the importance of maintaining neurological health for an adequate experience of romantic emotions. Healthy habits such as good nutrition, regular physical exercise, and adequate sleep can significantly influence our ability to process and express attraction. In my consultations, I often discuss how the hypothalamic pituitary adrenal axis, an important neuroendocrine system, influences our emotional and behavioral responses during romantic interactions. This system is particularly sensitive to stress, which can affect our ability to form emotional connections. As a medical professional, I have observed that understanding these neurological mechanisms can significantly help people who face difficulties in their romantic relationships. Knowledge about how our brain processes attraction can be a valuable tool for developing more effective social interaction strategies. In my trajectory as a urologist and andrologist, I have dedicated special attention to studying the hormonal influence on romantic behavior. Hormones are true chemical messengers that orchestrate a series of emotional and physical responses during the attraction process, something I explain in detail to my patients in the office. Testosterone, often associated only with male libido, actually plays a crucial role in both men and women. During my international specialization, I participated in research that demonstrated how adequate levels of this hormone are essential for the manifestation of romantic interest behaviors in both sexes. Estradiol, the main form of estrogen, has a fascinating influence on female behavior during attraction. In my clinical practice, I observe how the levels of this hormone affect not only physical aspects, but also behavioral ones, including how women express romantic interest through nonverbal signals. During my residency, I had the opportunity to study how oxytocin, known as the bonding hormone, influences our ability to form emotional connections. This hormone is particularly important in the initial phase of attraction, promoting feelings of trust and emotional closeness. As a specialist in sexual medicine, I often discuss with my patients the role of vasopressin, a hormone that works in conjunction with oxytocin to establish social bonds. Studies that I followed during my international training demonstrate its importance in forming lasting romantic ties. Prolactin, a hormone traditionally associated with breastfeeding, also exerts significant influence on attraction behaviors. In my lectures, I explain how this hormone is involved in mood regulation and the sense of well-being during romantic interactions. An interesting aspect that I observe in my clinical practice is how cortisol, the stress hormone, can interfere with attraction processes. Elevated levels of this hormone can make it difficult to properly express and interpret romantic signals, something I frequently discuss with patients facing social anxiety situations. During my specialization, I participated in studies on the role of endorphins in romantic attraction. These neurotransmitters, known for producing feelings of pleasure and well-being, are released in significant quantities during interactions with people who attract us. As a doctor, I always emphasize to my patients the importance of hormonal balance for a healthy experience of romantic attraction. Hormonal imbalances can significantly affect our ability to express and recognize signs of romantic interest. In my consultations, I frequently address how melatonin, a hormone related to the circadian cycle, can influence our patterns of social and romantic behavior. Adequate sleep and a balanced circadian rhythm are essential for maintaining healthy hormone levels. Serotonin, a neurotransmitter associated with well-being, also plays a crucial role in romantic attraction. During my clinical practice, I observe how adequate levels of this neurotransmitter are important for the healthy expression of romantic interest behaviors. As a medical professional, I consider it fundamental to educate my patients about the complex interaction between different hormonal systems and their impact on our romantic life. Understanding these mechanisms can significantly help in developing more satisfying and healthy relationships. In my experience as a doctor specializing in sexual health, I have observed how a person's general health directly influences their ability to express and experience attraction. During my consultations, I often discuss with patients how different aspects of physical and mental health intertwine to create the ideal conditions for satisfying romantic experiences. The endocrine system, which I always emphasize in my international lectures, functions like a delicate orchestra where each component needs to be in harmony. During my specialization, I participated in studies that demonstrated how metabolic imbalances can significantly affect the production and regulation of hormones related to attraction. Cardiovascular health, a topic I regularly address in my office, plays a crucial role in the physical expression of attraction. A healthy circulatory system is essential to sustain the physiological responses associated with romantic interest, such as facial flushing and changes in heart rate that we discussed earlier. In my clinical practice, I observe how sleep quality directly influences a person's ability to express and interpret signs of attraction. During my residency, I participated in research that demonstrated how sleep deprivation can negatively affect hormone levels and emotional processing capacity. Proper nutrition, a topic I always address in my consultations, is fundamental to maintaining the hormonal balance necessary for healthy romantic experiences. Certain nutrients are essential for the production and regulation of hormones involved in attraction, such as zinc, vitamin D, and essential fatty acids. Regular physical exercise, as demonstrated by studies I followed during my international specialization, can significantly improve our ability to express and experience attraction. Adequate physical activity stimulates the production of endorphins and other important neurotransmitters for emotional well-being. In my experience as a specialist, I have noticed how chronic stress can negatively impact our ability to form romantic connections. Elevated cortisol can interfere with the production of other hormones essential for attraction, in addition to affecting our ability to interpret subtle social signals. Mental health, an aspect I address with sensitivity in my clinical practice, is equally crucial. During my training, I participated in studies that demonstrated how conditions such as anxiety and depression can significantly affect our ability to express and recognize signs of attraction. As a doctor specializing in sexual medicine, I frequently discuss with my patients the importance of hormonal balance for romantic health. Regular exams and proper medical monitoring can help identify and correct imbalances that may be affecting their love life. In my lectures, I always emphasize how proper hydration and a balanced diet can positively influence our hormone levels, and consequently, our ability to experience and express attraction in a healthy way. The immune system, as demonstrated by research I followed during my specialization, also plays an important role in attraction. A healthy immune system can influence the production of pheromones and other chemical signals important for interpersonal attraction. As a medical professional, I always emphasize to my patients that health is a holistic concept, where each aspect influences the others. The ability to express and experience attraction in a healthy way is a direct reflection of the individual's general state of health. As a medical specialist in sexual health with over 15 years of experience, I consider it fundamental to conclude this discussion by integrating all the scientific knowledge presented with practical applications for healthier relationships. In my office, I often help patients understand how they can use this knowledge to improve their romantic experiences. During my international specialization, I learned that self-knowledge is the foundation for healthy relationships. Understanding how our own body responds to romantic stimuli, recognizing our hormonal patterns, and respecting our natural cycles are fundamental aspects that I always discuss with my patients. In my clinical practice, I observe how knowledge about the biological mechanisms of attraction can help people develop more realistic expectations about relationships. Understanding that certain responses are mediated by physiological processes can help reduce common anxieties and insecurities. Assertive communication, a topic I frequently address in my lectures, is essential for healthy relationships. As a doctor, I explain to my patients that, although nonverbal signals are important, clear and direct communication about needs and expectations is equally fundamental. During my residency at a reference hospital, I participated in studies that demonstrated how knowledge about our own hormonal patterns can help us make more conscious choices in our relationships. This understanding allows people to recognize when they need medical support for specific issues. In my consultations, I always emphasize the importance of maintaining a healthy lifestyle to optimize our ability to form and maintain meaningful romantic connections. This includes attention to diet, regular exercise, adequate sleep, and stress management. As a specialist in sexual medicine, I often discuss with my patients how small changes in their daily habits can have a significant impact on their hormonal health and, consequently, on their romantic life. Consistency in healthy habits is more important than temporary drastic changes. In my professional experience, I have observed how respecting the body's natural cycles can significantly improve our romantic experiences. This includes understanding and respecting our circadian rhythms, hormonal cycles, and recovery needs. During my specialization, I learned about the importance of an integrated approach to romantic health. As a doctor, I always encourage my patients to consider both physical and emotional aspects of their relationships, seeking a healthy balance between both. The regular practice of self-care, a topic I constantly address in my consultations, is fundamental to maintaining the health necessary for satisfying romantic experiences. This includes regular checkups, attention to mental health, and maintaining healthy boundaries in relationships. As a medical professional, I consider it essential to remember that each person is unique in their way of experiencing and expressing attraction. The scientific knowledge we share should serve as a guide, not as a rigid set of rules. Finally, in my clinical practice, I always emphasize that healthy relationships are built on a foundation of mutual respect, understanding, and open communication. Medical and scientific knowledge should serve to enrich these connections, not to limit them.